and welcome to Collegial Conversations with Diana Clark. Today, we are joined by Dr. Ryan Madigan, who is a clinical psychologist and founded the Boston Child Study Center for a conversation around tips for parenting emotionally volatile teens. Diana and Ryan, I will turn it over to you.
Thank you, Brandy.
Thanks, Brandy.
Ryan, welcome to Collegial Conversations. I remember hearing your name probably going back 7 or 8 years ago when I was looking for a clinician for a particularly difficult teen. And the word kept going, is he a lost cause? And I was like, what do you mean, is he a lost cause? And that was, well, that means that's Ryan Madigan's work. That was how I was first introduced to the fact that you work with extraordinarily difficult teenagers. So how did you get into that, Dr. Madigan?
Good question. We started out in 2013 in large part a response to seeing what works really well at a lot of the places that I worked and trained, and what we thought might help, close some of the gaps, and really just trying to do what made a lot of sense for kids. We have this sort of mental health system in our society that starts with the most acute at inpatient, and then residential, partial hospital, intensive outpatient, and then more traditional outpatient. And I think it's really well intended, but has some problems with it as well. And one of which is that each of those levels of care is very static. If you're in a PHP, you're getting 20 or 30 or so hours of treatment. If you're an IOP, you're getting, say, 10, 15. And then when you discharge, you leave that whole team and you sort of start from scratch. And we really felt like we could cover most of those outpatient, partial IOP, and traditional outpatient all in-house, and add more support as needed, and then fade that support back while the core team sort of stays the same. And that's, I think, one of the keys to our success with the more, I would say, challenging presentations. I think sometimes it's the adolescent or young adult, sometimes it's the family system that they're in, and sometimes it's just that they haven't really found the right match yet. That really that they've done nothing wrong. It's just incredibly hard to find the right help in a really broken mental health system.
Agreed. So when you think about, you're working with both the family and the identified teenager, mm-hmm. Which do you focus more energy on?
We as the therapists at BCSC focus, I would say 50-50. One of the first obstacles after sort of meeting with the adolescent identified client and trying to help them gain an understanding into their own experience, which tends to be a big factor in buy-in and motivation. The next obstacle tends to be trying to orient family members around the role that they're playing, whether consciously or not, and getting them on board with doing at least 50% of the work. Whereas I think the traditional mindset is, my kid is struggling, I'm going to drop them off at therapy, and that therapist is going to fix them. But we really underestimate how, some people think I'm a little bit dark for viewing childhood in this way, but how trapped kids are. They have so little agency and autonomy over their lives at home or at school. To not include those settings in the treatment process is really putting way too much of a burden on the kid or young adult. So that's a big part of what we emphasize. And I would say just about every single young person we see is, they're assigned a therapist, typically a DBT or ACT-based therapist, and their parents are assigned a DBT or ACT-based parent coach / family therapist who works with them and the family system.
Yes.
in addition to groups as well. And that's a big part of.
You're dealing with it in a parallel sort of process then.
Exactly. Yeah.
It reminds me of that analogy. If this is the family and Ethan goes off to treatment and does a bunch of work, and these people stay the same, what happens when that person comes back into that same game?
Right. Only the wisest of wise adolescents can work their way back into a system that's really not working to help them get their needs met and somehow radically accept that. You know, you really can't. If your core needs are not getting met, your brain won't let you accept that.
Right. So the subject matter when Brandy introduced you was tips for parents on dealing with volatile teens. What would those tips for the parents be?
It's a golden question. So I guess I'd start by saying, philosophically, every family that comes to us is struggling with a pretty universal issue in our culture, which is emotions are horribly understood. Any issue an individual struggles to understand, they're of course going to mismanage it. So when I meet a volatile or dysregulated teen or young adult who's struggling, what it tells me is that they've gotten to this point in trying to get their needs met, and that they're at the end of the toolbox, right? Nobody is difficult or challenging or oppositional or aggressive or dysregulated or self-harming as a first line of defense. It's the last tool in the toolbox, and what it tells me is something's happening that is interfering in those around this individual in really understanding what their needs are and figuring out how to help that person get their needs met. So the first and most important piece is helping people relearn or unlearn past misconceptions around emotions, and to really begin to shift away from thinking of emotions as symptoms and more as signals that are trying to tell you what your neurological needs are.
Right.
And that's a challenging shift. You know, I myself I think of myself as pretty good at this in my clinical practice. But even when I'm, home with my wife, I get irritable when I'm really feeling sad, because sadness to me, the way I was, raised and grew up, is kind of a sign of weakness. I was never taught that sadness is my brain telling me that something's missing. So learning to, teaching young people to listen to their emotions is step one, but teaching parents to view their kids' emotions as signals is step two, and really needs to happen in parallel. And that's the biggest challenge. We view kids who have emotion dysregulation issues as kids who have emotions that are too big. And it's actually a huge misconception. If you and I were in a building that were on fire, we would both experience an extreme emotion of fear, but we wouldn't get dysregulated. That emotion would be sort of symbiotic with our experience, and it would drive us to vacate the building. Emotion dysregulation isn't an extreme emotion. It's an emotional experience. Oh my God, the building's on fire. I'm going to die. I got to get out of here. With an opposing emotion that's saying, Ryan, don't be dramatic. Sit down. You're going to embarrass yourself. There's nothing wrong. And then you have this tug of war that breaks out within your own mind. And that's what creates the dysregulation that we see in kids that end up, earning the label of volatile or difficult or challenging. They're having trouble making sense of what their brain is trying to tell them because of all these emotionally invalidating messages that we get as we grow up.
Give me an example of for parents who are out there listening today, what does an emotionally invalidating expression sound like?
Awesome question. So there's overt invalidation, right? You might start to get upset, and I might tell you why you shouldn't be upset about that. It's not a big deal. You've got a roof over your head. You've got all these resources. Your life on paper is great, so you have no reason to be upset. It's any message that's saying you shouldn't be upset or you shouldn't be feeling the way you're feeling. It's any sort of negation of what a person's experience is. And that's the more traditional sort of overt criticism of a person's emotion. There's also more subtle invalidation. I find it sort of really interesting and telling that even within mental health agencies, when a therapist is having a hard time themselves and they become emotional, they start to get tearful. I find it fascinating how fast all the other therapists in the room are racing, trying to find a box of tissues to get it to that person, as if they're on fire and they're looking for a fire extinguisher. So even subtle messages like, clean yourself up, or jumping to problem solving to try to cheer a person up sends the message there's something threatening about that emotion, and we've got to sort of contain it before it gets out of control. So there's overt invalidation, you shouldn't feel that way, and then there's sort of more covert or subtle invalidation that communicates there might be something wrong with this emotion at baseline.
And I remember my early therapy in my late teens and early 20s. One of the biggest lessons I learned from my therapist was every feeling fully felt passes. It is the feelings that stuff that come out sideways, right?
Mm-hmm.
So anything that I guess would encourage a kid to stuff a feeling
is going to be a problem down the road. It's going to come out in some sort of ineffective way. When I introduce this topic to kids and parents, I usually use the iPhone low battery icon or a low gas gauge, or even just the dashboard on an airplane. If you got on an airplane and you saw a pilot responding to those signals, the warning lights, the fire, the issues, the way we respond to emotions, you would think that pilot was crazy and you'd hopefully get off that plane. So I usually start with something people understand, right? You'd want that pilot to listen to that signal. I move into other things like lethargy, hunger, pain. People tend to stigmatize those three a little bit less. And like you said, an emotion will pass if you can experience it and listen to it, right? When we get hungry, it's our brain telling us we're low in energy and we ought to replace it. When we eat, the hunger goes away. Emotions are the same way. If sadness is telling me something's missing and I can sit with that, figure out what that thing is and reconnect with it, the sadness goes away. And I think a lot of us are fearful that if we let it in, we'll lose control, it'll last forever, it'll get worse, and it's quite the opposite.
it will take us down the big sinkhole of feelings.
Yeah, exactly.
That's been my experience with people who were trying to contain them. And I do think we, even as what you were saying, as therapists, reaching over with tissues, like a house is on fire. Culturally, we're not comfortable with feelings.
No, and that's our job as therapists, is to not only help the young people we work with sit with their feelings and learn that they're not only not threatening, but really trying to be helpful. They're trying to teach and tell us what we need. And then in family therapy, helping parents sit with their kids' emotions as well and not put the fire out, not problem solve, not negate their experience, and really become aware of this idea that your child's brain is trying to tell them something, and all these efforts to make that emotion go away are actually interrupting that message, that their ability to hear that and be more fulfilled as a result of listening to it.
Right. Signals, messages, feelings. Yeah.
Exactly.
What are your favorite books for parents to help them sort of recondition their thinking? Do you have books that you recommend?
Sadly, there aren't too many good ones. I think if your kid is really struggling, they're dysregulated. My favorite would be Michael Hollander's book, Helping Teens Who Cut. Most of the young people I work with are not crazy about the title, but the content of the book is fantastic. And even if you're,
I'm going to write that down.
Yeah, even if your child is not struggling with self-harm per se, if you replace the topography of self-harm with whatever behavior you are struggling with, the book does a wonderful job of really helping parents understand what emotion regulation and dysregulation means. And you can kind of like replace self-harm with whatever the behavior is, because it's all about the function of what that behavior is serving, and they tend to, have a lot more in common than they don't have in common.
Right. I remember family systems books going back, Harriet Lerner's work in The Dance of Anger and The Dance of Intimacy and Not Over Functioning and her way of explaining physics. And that's always been very helpful for me, but I think some of that work is probably too elemental these days. I don't know.
Yeah, I don't know that one, but I know Michael's book, parents have really found make these sort of very cerebral, psychological phenomenon much more palatable and useful. So that's a good one that I'd recommend. And really getting into the weeds on understanding emotions as having a function or signal it sounds so simple on paper, but in how you integrate it into your day-to-day life, and especially how you use it in interactions with your loved ones, that's the hardest playing field, if you will, to actually apply it, because that's where our emotions then are urging us to try to fix their emotions.
Mm-hmm. What do you see as the biggest challenges for parents culturally right now, post-COVID or during COVID? Yeah.
Well, yeah, I mean, during COVID, most families and adolescents are being asked to do something that is developmentally inappropriate, right? Our task as teens and adolescents is to establish peer connections, and not necessarily leave our families, but to build upon the family we were born into, and to kind of develop a secondary family of friends and loved ones. And to be trapped at home, and I fully acknowledge why it was medically obviously necessary given the pandemic, but developmentally it's an emotional obstacle that makes it really, really challenging for young people to not struggle and not suffer when most of their needs are really outside of the home.
Right.
So that would be a during COVID obstacle that I think is probably one of the biggest. And the easy target would be to go after social media and talk about how families need to find a way to balance. If you take away social media, a kid has no access to their peer groups. If you have it unfiltered, kids get into trouble. So there's got to be a balance in between. But I actually think, and this might be very unpopular, but I think the emphasis we put on school is massively overrated. And we put kids through hell and stress them out and make them feel terrible about themselves if they don't succeed in the traditional academic setting. And, school is an incredible resource for kids that it jives with. And for kids that just don't learn that way or are having struggles emotionally that prevent them from accessing learning, school is a great place for your social, emotional, and academic self-esteem to really take a hit. So I think that's a big part of the work we do, is to try to help parents recognize that, there are a lot of different paths to independence and happiness and success. And the traditional 4-year, high school and then 4-year college and then perhaps grad school, that's not for everyone, and it doesn't have to be. Enforcing that can really make a person miserable.
So, and you are, just for our listeners, again, this is the Boston Child Study Center. So if I think of competitive high schooling, I think of Boston.
Oh, yeah.
People applying for high schools as rigorous as application process for colleges. And I can't.
Yeah, and it makes you think your whole identity, your whole self, your whole future comes down to what school you get into. And it couldn't be further from the truth. There are people who go to community college or no college at all who end up being incredibly happy and successful. And there are people who go to Ivies who are miserable. If you're doing it for the wrong reasons, nothing works. And I usually joke that, the good news and the bad news growing up in Boston is Harvard and MIT are contagious. And that's good in some ways, because learning and intellectual curiosity is valued in Boston in ways that perhaps not as much in other cities, but it's also a pressure cooker as a result of the culture of really needing to be high academic performing. And it just doesn't bear out in the data. It's just not as important as our culture makes it.
I would like to see families really embrace the idea that that is a really small chunk of time compared to this huge expanse of adulthood now that has nothing to do with education.
Nothing at all. I totally agree. I think, education is something you should pursue when you have to, right? I mean, psychologists, you have to get a degree in higher education in some form in order to practice. So there are certain professions where, yeah, academics are important, but this new age of entrepreneur, explosion, I think, is really highlighting that it's definitely not the only path, and there's a lot of ways to build a really happy and successful career.
Right. And then not everybody is going to be destined for the upper middle or upper class life.
Nor do they have to. The research shows that those are some of the most miserable groups of people. I worked on a study as a research assistant in between undergrad and grad school, and I didn't find the principal investigator I worked for at the time found that the highest rates of psychopathology are in the poorest families and the richest families. The middle income families seem to do the best. Largely, I think the hypothesis is that parents are typically, in the role of primary parenting, and that really helps.
That does help. Two parents focusing on children.
Yeah, being around. Perhaps you don't earn as much as the family across the street, but you're home at 5, you're home for dinner, and that there's no price tag for that.
Right. So before we stop today, Dr. Madigan, what would be the one takeaway? If you could say, I'd like people to take away one thing from this, what would that be?
I'm going to sound like a broken record, but emotions are signals, not symptoms. And honestly, even symptoms of mental health disorders, I don't believe are truly symptoms. I see them as coping strategies for dealing with emotions that you believe to be a problem. If we can help people change their relationship to their emotions and view them as signals, most of the emotion disorders that we see will go out of business.
I love that. I'm looking forward to that day.
Me too.
Thank you for joining us today.
Absolutely. Thanks for having me.